This course will look at the roles and responsibilities of a home support worker. We acknowledge that we are on the traditional lands of the indigenous. We honor the indigenous people who have cared for this land for generations. We are committed to learning and supporting indigenous communities. This training is designed to help Total Care's home support workers understand their role in providing quality health care within the community. You will learn best practices and tools to ensure you can deliver the highest level of care to your clients. At the conclusion of this training, Total Care will arrange a practical education session where you can apply what you have learned in a hands-on setting. This session will ensure you feel confident and prepared to provide care and will also give you an opportunity to ask questions and clarify any concerns that you may have. Now let's look at a few important terms. What does it mean to be a Total Care home support worker? You provide care and assistance to a client who needs assistance with being able to remain independently in their home for as long as possible. The client would be any person who requires support services in the community. Client-centered care is care that focuses on dignity, independence, individualized care, preferences, privacy, and safety of clients and their families at all times. The Circle of Care is a coordinated approach comprising of healthcare professionals, formal and informal caregivers, family and community resources that all work together across the care setting to deliver holistic, integrated support. Activities of daily living would be activities that people perform daily to remain independent and able to function in society. Instrumental activities of daily living are complex skills that a client needs to live successfully, independently. Goals of providing home support services: to enhance quality of life for a client. We want to support the client and their family by delivering person-centered care that respects the client's wishes, values, and their preferences, ensuring that they can live as independently, comfortably, and meaningfully as possible. Actively participate in the circle of care for the client. To collaborate with all members of the care team as required by sharing relevant information, staying informed, and contributing to all client care needs. To maintain privacy and confidentiality, uphold the highest standards of confidentiality regarding the client's health, personal information, and life wishes in accordance with the privacy legislation and ethical obligations. Follow the agreed upon care plan. Deliver care in accordance with the client's individualized care plan, ensuring that services are safe, effective, and consistent with best practices and with clinical service guidance. We want to promote dignity, respect, and empowerment. Treat every client with dignity, respect cultural and personal values, and empower them to make informed decisions about their care. Commit to ongoing learning and improvement. Continually build on your skills and knowledge to improve service quality, adapt to evolving client needs, and meet the highest standards of community care. Now let's look at the responsibilities of you, the support worker. The general responsibilities of a home support worker that works for our company would include the following: personal care, assisting your clients look after their personal care needs, support the other members of the client care team, provide support to the family, provide social support, housekeeping and home management as required by the client, and documentation as required. Now let's break them down. First, we will look at personal care. It is important to understand that personal care responsibilities include assisting a client with their activities of daily living, as well as supporting clients with their instrumental activities of daily living. Activities of daily living include personal hygiene, grooming, toileting, mobility, eating, and drinking. Instrumental activities of daily living include, but are not limited to, managing medications, household management, shopping, transportation arrangements, assisting with finances, meal preparation, and assist with attending any social activities in the community.